Okay, for some of you on the call today, you may have limited knowledge of HealthNow MD. You may be fairly new to us. Most of you on the call have a pretty good understanding of HNMD, but really want to hear more from your peers about how they are using HealthNow MD to take their business to the next level. And that's what this call is all about. There's a major buzz in the marketplace right now with HNMD. We have a service that is predicted by many professionals in the healthcare space to completely revolutionize how we all access healthcare. The foundation of this is what we call telehealth. So telehealth, it's simple. It's using technology such as a phone, email, or webcam to get connected 24/7 with a licensed physician in any of the 50 states to take care of up to 78% of your healthcare needs. Now, most people don't realize that roughly 80% of the reasons we visit the doctor office, urgent care, or ER can be handled right over the phone. Now, as you can imagine, as more and more people adopt this service, and it's built into health plans here through you all on this call, and really understand how effective and safe it is to take care of many of your needs right over the phone, it's greatly going to impact claims and healthcare costs. The beauty of the service is it drives down claims and costs. You get paid to sell it, and it provides an amazing benefit for employees and their families. So when you can provide your employees with a benefit, giving them access to a nationwide doctor network 24/7 waiting to address their needs, and having their electronic medical records in front of them on the computer is very powerful. And believe me, we are getting calls from HR directors and members raving about this service. In fact, we just had a call a couple weeks ago from a 65 Life group here in town. I think it may have even been one of Bob's groups. Just the HR director was just raving about it. They had just launched the program on Friday. It was Tuesday or Wednesday of the following week already. She said 4 people already used it. It's the buzz around the office. This thing is so cool. Keep doing what you're doing. Okay, so let's get to our special guest today to hear how he uses HNMD to differentiate himself in the market, grow his business, make employers happier, and put more money in his pocket and his brokers. Our guest today is the #1 producer with the Trans-America Gap program, #1 in the country. He's one of 5 general agencies that are lifetime field advisory board members for United Healthcare. He's been in the group health business for over 20 years and is HealthNow MD's top producer. So I'd like to please welcome Bob Hart, Principal of Paragon Partners.
Good morning, everybody. I know quite a few of you on the phones. Right? Hey, Robin. Hello, Robin. I know you can't talk back. It's actually a good thing for me for once. Right. I hope everybody was able to print out those sheets. It might make it a little bit easier if you haven't hold. But can I get to my sheet now, Scott?
Yep, we'll get you switched over here in just a second.
There it comes. Come back up. There we go. Show my screen. Get my screen showing there, everybody?
We can see it.
Okay. We're going to do this pretty quickly, and I know this sheet to a lot of you is going to look pretty confusing, but it really is a very, very simple sheet. And this is the program that we use with Transamerica. And this side, the left side of the sheet, is the total premiums for the group. The right side is just the company costs and contributions. As you can see in the ledger up here, green is just their current rates, brown was their renewal rates, and the blue highlights is what we're taking them to. So in this particular group, as you see in the census right here, it's 39 employees, right? The current premium is $325.98 a month, and they were with Blue Cross Blue Shield here in Arizona. They had a $500 deductible, $20 20/40 copay, $580, $20 to $3,500 out of pocket. Right? The group itself, on their renewal, got an 11% rate increase. Not so bad, but still going from $325 to $361. Right? The employee cost, right? The employer cost, sorry, went from $275 to $306. So they went up about $1,400 a month. Probably a little bit on the high side right now. So what we were going to do, right? When I take, they were paying paying about 85% of a single, paying about a little bit over 1% of a spouse, 0 of a child, and paying 28% of a family rate. Their total cost was currently $12,735 a month. The box that's most impressive, what I do, how we make the presentation to make the HealthNow work, of course, especially with this, is the company cost. So on the current, again in the green over here, when I take that $12,735 and divide it by the 39 employees, the cost is $326 a month per employee. Their rate increase was bringing them up to $362, it's $35 an employee per month, 11%, $1,400 a month, or $16,000 a year. We're going to bring them from Blue Cross Blue Shield to United Healthcare on an HSA plan, and with all the additional benefits that we added, including the HealthNow and an HSA account, the company cost is only going to be $290 a month. So we're going to save the employer $36.48 a month compared to current. We actually beat the renewal by $72 an employee. So I'm going to just tell this employer, we're going to save you $17,000 over your current cost. And at the same time, I'm going to take your single employees from going from $50 a month, what we're going to left is the employer cost per month, right? If you're paying $50, down to $21. A spouse is going to go from $350 a month down to $260. Employee and children is going to go from $250 down to $173, and a family is going to go from $500 down to $346. And all I've done, if I go up here a little bit, here's our United Health Medical Plan here, the HSA rate is lowering their cost by $9,300 a month. Now, as brokers, you all know a problem with that is most employees can't handle the HSA because they can't afford the out-of-pockets. Well, because I had so much room here, right, I was able to take this $9,300 savings here by adding in the HealthNow, $15 for a single, right, $28 for spouse, $24 for a child, and $29 for a family. It's a total of $779 a month. I then had the client fund $75 for singles and $125 for dependents, another $3,600 a month. I added in, from Transamerica, a $5,000 critical illness policy, and that's to help reinsure the HSA funding. Right? It's only $227 a month. We then also added in an accident policy that somebody on the HSA account, one of the kids gets hurt, they don't even have to use their HSA account. The accident will be there to help them supplement that. So when I add all these products together, my total premium is $16,425. It's $4,100 a month less than what they're currently doing. It's $6,300 less than the renewal. Now, the next page you go to is your benefits at a glance, right? And by the way, my email address is up there. If any needs any questions or any help after this, feel free to email to me or call me at the office. Not an issue. So we're going to meet with the employees, and I'm going to say, okay, your health insurance is not going to be from United Healthcare, right? And as you can see, it's Plan 1, it's the AA Pre. Anybody in Arizona probably knows that. Matter of fact, if you're with multi-plan with United Healthcare, you're probably familiar with it already anyway, along with the HealthNow MD. So, line 1, primary office visits. All right, annual checkups are 100%. So we have a benefit. We stand in front of the employees and we say, okay, you're going to pay 20% after the deductible, all right? And the deductible on this plan is $2,500, or 0 HealthNow MD. Now, according to the American Wellness Council, 70% of all doctor visits are not necessary. And we all kind of know that anyway. We're in the business. Well, the cool thing about this is what we're finding from employers when we show this benefit on what it means to their employees, especially on the HSA. You know, if they can call a doctor first for free, there's a good likelihood they don't need to go to the doctor and use their HSA account. Now, whether you're a group of 39 or a group of 100, right? Add the members in there. If you could cut out 40 to 50 doctor visits a year in a small group like this, what happens to the renewals? They should get better, less utilization. Plus, it's a way of encouraging employees to save their HSA accounts for a rainy day or save it up for the retirement. we've had great success with this because what an employer will now say to you is you're meeting with a group. So you mean to tell me instead of my employees have to pay a copay or anything, they could actually call HealthNow and pay nothing. That's correct, right? And it's working. The group that Scott alluded to earlier was that local group here in Phoenix. We had a real rough time with them getting them in the system. It was just one of those HR directors that was really, really tough. So when that email came in back a week ago, it was really rewarding. Right? Specialist, 20% after deductible. Right? You know what, I want to go back here for a moment on the HealthNow MD. What quite a few of the employers tell us in the meeting, so you mean to tell me if one of the kids has to go to the doctor, they can actually do that right from here instead of going home and taking their child to the doctor? So that's correct. Right? Get that out of here. That's correct. So it cuts down on missing work time also, another advantage. Right? Lab x-rays, guys, I'm not going to go too much into the benefits of the medical. Most of you know it. United Healthcare, it's that $2,500 deductible to $3,500 out of pocket, max. Well, if you remember, the current plan was also $3,500 out of pocket. Well, we funded $75 a month for the employee on the HSA. So technically, the first $850 or so, right, the employee's at 100% of the $2,500. Well, after they hit the $2,500 deductible, everything's 20%. They have prescription copays for the next $1,000 total. It all adds up. They hit $3,500. They're 100%. Because of this, all right, I want to talk about on the broker sales side, being a GA, one of the tough things is, a lot of groups went to the HSAs over the last couple of years, but a lot of the employees, they didn't get funded, right? And a lot of the employees basically had a plan that they couldn't even use, right? So if I was doing a renewal group that had the HSA already, just by adding in the HealthNow, their employees now have a benefit they can use immediately, right? The ones that were switching, they're still better out of pocket going from a copay plan to this, right? Because we're also going to protect them in a whole bunch of different ways. We've added in that critical illness policy I told you, right? And this policy will pay a covered person $5,000 when initially diagnosed with cancer, heart attack, stroke, end-stage renal failure, or a major organ transplant. Fortunately for us at Paragon here with Transamerica, we have guarantee issue down on that product down to a group of 2. They're about the only one in the country that can do it. It's been very helpful because I now want to tell an employer or the employee, listen, in every group, in this group of 39, we know that we have a couple of couch potatoes in there that are just heart attacks waiting to happen. Well, the issue is going to be is he has a heart attack and he has $800 in his account. He could owe about $2,500 or so. Well, now he's going to collect a check for $5,000. That's going to pay his max out of pocket. He's now at 100%. And he can save his whole HSA account. Right? Spouses, everybody's included, this guarantee issue. And another thing that we've added in here, in this blue line, you'll see this policy will pay a covered person $50 each calendar year for cancer and heart screening wellness plans. So some of the things that you want to promote, the 100% wellness now under healthcare reform, especially in the HSA accounts, well, now you can say, go for that, it's free, and we're going to pay you $50. And they don't even have to file a claim form. If one of the females goes for a Pap test, as you come walking out of the examining room, just call in your little Transamerica Gap card plan, right, the health pack plan card, right, that, I'm so-and-so and I just had my Pap test done. They're going to ask for a member ID or social security number. They're going to ask for the doctor's name and address, right, and what they had done. Well, I had a Pap test done. They'll take that information. They'll immediately mail her a check for $50 with no claim form. So all brokers, as you know, we're trying to promote all these wellness things and getting people healthy and doing the tests they should, especially the males over 50. I mean, in fact, in that group, Scott, Best IT last week, right?
Yeah.
When we first enrolled that group, one of the owners was 52 years old, still had not done his colonoscopy test, right?
Wow.
So it's those kinds of things. We want to try to, get people to do those things because, as we know, our worst nightmare for claims is the male population above 50 because they don't take care of themselves. Well, hopefully, this is one of the ways of doing it. The company could even promote this, right? If it's a bigger company, a couple hundred lives, right? An easy thing to do. I know they're around the country. I don't know in every city, but in Phoenix we have a mobile on-site mammography, right? They actually bring a van out and they'll do spouses and employees mammograms right there at the site. So when you do that, we just take the list, we send it in Transamerica. Each one of those employees gets their $50 check. All right. We also, because there's one thing we know we can't help that we included, is the accident advance plan. And it's a slight accident policy. And what this does, right, if an employee or dependent gets hurt, if they go to any treatment, any doctor's office, emergency room, anywhere, this plan is going to pay them $250. Now, we want to teach the employees to do a couple different things. First off, if it's really not that bad of an injury, right, like say it just looks like it might be a twisted finger, well, maybe instead of going to the emergency room, hopefully they'll call HealthNow first. Because the other thing that we know about HealthNow, a good majority of the physicians that are on the calls are emergency room physicians. So that could save an awful lot of money for a group, because we know the average emergency room claim is now up to about $1,700. All right? We want to try to save that in claims. So we're going to tell an employee, listen, if you go to the emergency room and it's $1,700, this part will pay you $250. Go to an urgent care center, right? That same claim would only be $400. We'll pay you $250. Go to Doc in the Box. You know, CVS, Walgreens, Walmart, they're all putting the doctors, the primary care doctors in front of the offices. Go there, that same thing would be $60. Right? Now, it's not going to work for a broken leg or anything bad, but if it's a couple stitches or something like that. So, Scott, I'm going to use you as an example. You know, your little guy, right? He gets a cut on his finger. He might need a couple stitches. Take him to Doc in the Box, right? We're going to pay you $250 on plan one, right? We'll give you $30 on a follow-up treatment, right? If you want to buy up to plan two, it'll pay you $60. Get an MRI or a CAT scan while you're in the emergency room or due to any accident injury within the 96 hours of claim, it'll pay an additional $400. Initial hospitalization will pay you $150. Hospital income of $25 a day. Here's the good part. If one of your kids breaks a leg, that emergency room charge is going to be around a little bit over $1,700 on a broken leg. Well, if it's a broken nose or ribs or a finger, policy will pay you $700. If it's a broken leg, it pays $3,400. Well, guess what? Just on that broken leg, you now became 100% on your health plan. Right? It's just different ways of doing things to cover those benefits. Physical therapy, right? Most plans in the country, physical therapy is now part of the deductible coinsurance. We will pay up to $30 per visit, up to 10 visits. Divide the plan two, we'll give them $60 a visit. Has a little bit of life insurance in it. Get a cut under 3 inches, it'll pay $56. On plan two, it'll pay $80. 3 to 8 inches will pay $210. Over 8 inches pays an additional $420. So we've just added all the benefits. Now, to do it easy, this is the fun part. As in brokers, and I'm going to speak mainly about HealthNow, this is an enrollment sheet that Transamerica spreadsheet does for us. As a new broker in this group, we're able to go in and say your current weekly deductions in the green were $11.54. Your medical with the HealthNow MD is $5 a paycheck. It includes the critical assistance, and it includes that accident policy. A family was $115, it now went down to $80. Right? They can contribute on more, and if they want, another $40 per check if they'd like to on a single, or they can put up to $85 a paycheck for families if they should so choose. Well, let's just take that family. They went from $115 down to $80. So they save $35 a month. Well, if they took the $35 plus the employer was putting in $125, we now have $160 a month going into their HSA account. The accident was all included. The buy-up plan for the accident was a couple dollars more, not much more money. But guys, here's the big thing. On the HealthNow MD, we now know that less than 20% of all enrollees in a group put their dependents on the plan because of cost. So, Eric, I'm going to use you now. Eric, you know your wife works for another company, so her health insurance is there. Your health insurance is here. You're paying $11.54 a check. You're now going to go to $5, but your HealthNow for you is included. If you'd like, Eric, for $3 a week, you can put your wife on HealthNow for $3. Or you could just put your kids on for $2.08 a paycheck, or you can put your full family on for $3.23. Now I want to let everybody know that this part of the benefit is a value add that you can't believe the response. Most times, we only have 75% of the employees enrolling. We're getting 100% of people buying the HealthNow for the dependents. So people who are not even on the plan are buying into HealthNow. We went to a restaurant chain in San Diego. They had 78 employees, full-time employees. And he was trying to do health insurance. Of course, in restaurants, everybody knows it doesn't work. Well, they had a mini-med program in there. And out of the 78, they had 11 people in the mini-med. Well, we went in and we showed him this. He bought the HealthNow for all his employees, including part-timers, right, along with the accident policy, just to be able to offer them something. We ended up with 140-something people on the HealthNow MD, right, because of the part-timers. And the employer paid for that for everybody because he wasn't able to afford benefits. But at least he gave them something where if they get sick, they can call the doctor. If they get hurt, they have the accident policy. So it's just a different way of making a presentation for a company to show them some solutions and also to try to slow down utilization. Because there's one thing that we all want to be careful about with healthcare reform, the exchanges and all that. We got to find value in what we do to stay in this business. And this is adding value because we're driving down utilization. I'd like to go back to the summary page a minute because it'll probably make a little bit more sense now. We talked about the medical rates going down to about $9,300, the HealthNow, the HSA savings accounts, and that can be changeable to anything they want, right? The critical illness actually only turned out to be $227 a month. You really can't buy a disability policy anywhere like that that can help employees with the deductible. And the accident, we're going to protect who needs it most. Kids are at risk, families with kids are at risk. This is a great help, right? So when we go back to the enrollment form, Eric, you were a single employee again, it was $5, but for $2.47 a week, you could put your whole family on the accident plan. So just different ways you can mix and match. Make what's going to make it work for the employees, because if we do that, we all win. If I look at my commissions, you know what? United Healthcare now in most part of the country is per member per month, right? There was no loss in commission there. The HealthNow, Paragon Partners is averaging $23 a month per employee per month between singles and families. So our brokers are making an additional $3.45 per employee per month. It never goes away. The critical illness is another 21%, so he's making another, 40-something a month. The accident policy is making 48% commission. He's making another 200 and something a month. So we took a broker here who was averaging about $22 a month per employee. He's now going up to about $42 a month. His employees are paying less and in a roundabout way have richer benefits. And all this happened with this group, because this was the second year in for us on this group. The only reason we were able to get in this year was because of HealthNow MD. We had showed our gap plans, we showed our critical illness and our accident. But this year when our broker went back in, right, we pitched the HealthNow. And the owner said to me, that makes sense, right? And they absolutely love it, right? They went from their PPO plan to the HSA, and they're now using it as a retirement account also, right? We are getting more calls from the the employees themselves, they're thrilled about the HealthNow. It truly does work. Our company, we have it in, right? We use it ourselves. It's a great program, and it's easy. It's not hard to use. We could go over one of the phone calls, one of the videos, but it's really pretty simple, right? And if I could tell any broker anywhere in the country, when you can show a different way of utilization, to slow down utilization, make your worth. Show why you're a better broker. I can show your company how to get better renewals. So even with this group, this year they were $20,000 in premiums. Even if they get a 5% rate increase, it's going up $1,000 a month. Well, if I get a 5% rate increase on this plan here, it's only $450 a month. So we're showing our value. The HealthNow, we don't expect those rates ever to change, right? In fact, Scott, I'm going to let you take it after this, but from the way I see it and the way I understand it, I've never seen a company promoting utilization. They really do want more utilization, right? So if we have any questions, people, you can send a text in. I can get back to you. You got my email address at the top of the sheet that we sent to you. Scott, there you go.
Thank you, Bob. Great job. That really shows how you differentiate yourself in the market. Certainly, to everyone on the call, it's not the only way HealthNow MD is being sold, but as you can see, it's been extremely effective for Bob. And really, what's making Bob the top producer here at HealthNow MD, as he mentioned, is every quote going out his door, he's got HealthNow MD packaged in there because it's giving him that edge in the marketplace, differentiating him. And as we mentioned earlier, the testimonials are coming in left and right from the employees and the employers, HR directors, really just raving about this service. And as a reminder, it's not an insurance product, so the enrollment is very simple. There's no underwriting involved. And as Bob had mentioned, it's very easy to use. If you know how to dial a phone number on the phone, you have access to our product right away. So pretty exciting. Thanks again, Bob. Next, I'd like to real quick introduce Eric Kronengold. Many of you know him out there in the field and have worked with him. He's going to walk through real quick. He's going to show the hnmdagent.com site, which is our online resources site. Walk you through that real quick and show you how easy it is to enroll a group. So, Eric.
Thank you, Scott. Hi, this is Eric Kronengold, Executive Vice President with HealthNow MD. A lot of familiar names on the call today. Thank you for joining the call and taking time out today. Bob, are you still on the line, Bob?
Yeah, I'm here.
Can you, I know Scott mentioned that 100% of the quotes going out the door from your agency are including HealthNow MD. Can you tell me why that is and the excitement that you're getting out there from the brokers and the employer groups that are using our product as a tool?
Well, Eric, I used the HSA as an example today, but I would tell you probably less than 25% of our groups ever do HSAs. But most of the health plans today, they're increasing the cost of the copays. Like United Healthcare, pretty traditionally right around the country, are $30 for primary, $60 for specialist, right? Some of the carriers, like in the Ohio area, I know they're going to like a $35 copay with Aetna and so forth like that. Well, that's a lot of money for anybody to be able to afford. Well, the HealthNow, when you take that difference in with a high copay, you won't believe the difference with the employees, because now they know I can pay $35 or call this for free. That's why utilization's working. And they're so relieved to have it. So it's an easy pitch. And let's face it, $15 on a $300 medical premium is nothing.
Yep, I appreciate it, Bob. Thank you. So a lot of the agencies on the call today are already producing with HealthNow MD, and we really appreciate that. We look to help you grow your business, to help you be successful, to grow your overall lives on your book of business. And what, like Bob had mentioned, not only is going to increase the value that you bring to that employer group or to brokers if you're a general agent. What we're looking to do, though, there's an internal initiative that we have going on for agents and agencies that have not produced with us yet. We want to help you, and we're here to help you get to that business. So we have an internal initiative over the next 90 days. If you haven't produced business with HealthNow MD, we want to make that change. So we're just looking for that first case to kind of get you involved, get you going, and you're going to see how like Bob mentioned, this goes out the door on every quote out there in the marketplace, and it gets to be contagious. Brokers love it, the employer groups love it, it's fun to talk about. I can't tell you how many open enrollment meetings I've gone to where I follow up with the company rep from the group health side, and everyone's eyes just glaze over. And when I get up there and talk about 24/7 access to a licensed physician via telephone, and they'll prescribe medication and diagnose in 91% of the cases, everyone's eyes light up. I've had standing ovations. I've had people just amazed that we can even offer this service, and their employers look like heroes. So the tools that, I know a lot of you have gone through a lot of these tools, but I want to make everybody aware. Hopefully you can see my screen now. The main website for broker support, agency support, is hnmdagent.com. And you want to go under the resources tab, and everything that you could possibly want to submit business, to present and explain this product out to the field is located on this site. You have downloadable brochures, welcome letters of the sample ID cards, training manuals that go over very detailed about our product, frequently asked questions guide, and then there's all the application and group census information there as well too. There's also online ability to, if you're an agent, you can go right online and sign up to contract with HealthNow MD. You'll be under a general agency, so that field will fill out. If you're a general agent, all the forms, we can custom make those forms actually to go for your general agency, so you'll know that those brokers are contracted directly with you. You can also make adds and deletes from the site. So everything in order to do business is available out there today. General agencies, if we haven't done a training call with you, contact me directly. You can get me at Eric, E-R-I-C, at healthnowmd.com, and we can set up a training for your, not only for your internal sales team, but for your support staff, your contracting staff, and your CSRs as well too. And look for, over the next 90 days, you're going to see a lot of tools from us. We're going to get a lot better at making brokers successful out there. So we're going to be providing a lot of new tools over the next 90 days, and we're going to be providing a much greater communication, not only to the brokers, but to the employers and the employees within those groups. Like Bob said, we want people using this, so we're going to be contacting the HR directors, the point of contacts within the companies, and let them know the service is available. You have it. Use it. We want you to use it because, like Bob said, over time, our main goal is to help you drive down costs on your existing health plan, but also use our product so the retention remains the way it is. And I've got to tell you, folks, the retention on our side is amazing. It's well over 95% retention that we have on our existing groups, and we don't see that changing in the near future. So I'm going to turn the call back over to our Chief Growth Officer, Scott Stanford, to wrap up. We appreciate your time today. Scott, the floor is yours.
Thanks, Eric. Just a couple of things to wrap up here. We have a promotion going here for through March 15th, a $5 bonus, one-time bonus for all new groups submitted. You submit a 100-life group to us, you're going to get an extra $500 bonus for that through March 15th, so something to keep in mind. We do have another webcast we'll be announcing here shortly, so look for a private invitation to that. We're going to have our 2010 Physician of the Year on the call, just explaining to you. You'll have a chance to chat in some questions as well on the things he's addressing to the members over the phone. In fact, the top 9 conditions most often treated at the doctor office and urgent care and ER, we handle right over the phone. He's going to explain how that works, what he does, and why he's so excited about telehealth and HealthNow MD, and why he's shifted his business to go over the phone and lean on technology to share his expertise to so many people out there. So keep an eye out for that. It's going to be a great call. We're also going to have a couple of HR directors and employer groups out that are brought on the program, sharing some of their excitement and stories. So much more to come. I just want to thank everyone for taking time out of your busy schedules today to hear more about HealthNow MD. And also greatly want to thank our special guest, Bob Hart, who is instrumental in bringing HealthNow MD to the broker world. and sharing some of his trade secrets out there. So everyone have a great rest of the week, and we look forward to speaking to you all again soon. Take care.